And while we're talking breast enhancement, something that really gets my goat are media reports of practitioners promoting a form of breast enhancement called awake enhancement, meaning that the patient is awake during the procedure and the surgeon or the physician sits them up during the procedure and they can look down at their breast and say, oh yeah, that's the size I want. Well, first and foremost, I can tell you that breast augmentation surgery can be done under local. Should it be done under local? I think it surrenders a whole lot of control and also puts you at increased risk for complications. If you're going on top of the muscle, subglandular, you can do a breast augmentation under local with some sedation. But usually the sedation is to the point where the patient is dopey anyway, and it's like having a drunk. So you're going to sit the drunk up during surgery, and they're going to look down, and they might be seeing double. They might see 4 breasts for all I know, and they're going to be able to tell you, yes, that's what I want. That to me that's marketing a procedure at its most crass. I am very, very against that form of a procedure. I just think it doesn't put patient benefit, it doesn't put patient safety first, which is what we should all be doing with this procedure. Doing a breast augmentation under the muscle, under local with just some sedation, invites lots of problems because the muscle often fights the dissection. It becomes more difficult to put the implant in. When I do my breast augmentations under general anesthesia, which I do all of mine under general anesthesia, I have the anesthesiologist relax the muscle so it facilitates my dissection. So I just don't think that this has a place in breast surgery. I think if you do your research and you see what practitioners are promoting this awake breast augmentation, you won't find too many board-certified plastic surgeons offering it. You're going to find cosmetic surgeons offering it. And we all know my feelings about plastic surgeons versus cosmetic surgeons. Plastic surgeons are trained as surgeons first and foremost. We understand surgical risk. We understand general anesthesia. I'm not afraid of general anesthesia. Somebody that is trained in dermatology, they aren't too familiar with general anesthesia, and therefore general anesthesia intimidates them. Therefore, they're going to promote procedures that only use local anesthesia. The plastic surgeon is uniquely qualified to know the merits of general versus local anesthesia and the pros and cons to either of those, and pick the one that's right for the patient. And when I mean right for the patient, I mean the safest and the one that offers the best promise of a good outcome.